the work we're involved here is rather difficult to explain. Those of us who need to get grants to support our work find it's very hard to explain this to the grants officer. We say that our work is in bioethics because it has the work we're involved in has to do with health and biology and so on, but it's about the ethical dimensions of this. But what makes us different from many others who say that they're in this field is that we're not working at the clinical level. It's not about the doctor and the patient relationship, for example. It's also not necessarily about how we should use new biotechnology, which fascinates people so much. Instead, it's about the health of populations and ethical questions that come up when we consider health at the population level. And it's hard to explain exactly what this means, but let me give it a simple example. At the clinical level, a doctor may take pride in treating patients regardless of their social background. Maybe he has low status patients and high status patients and treats them all alike. Or maybe the doctors say, for me, the question is, what does the patient need? I'm not concerned about gender or race or sexual orientation or any such thing. I'm just interested in them as a human being who has a health problem. And that's a kind of equality. That's fine. But if you ask that doctor whether the population of patients in his or her region has similar health status, that's not something the doctor is in a position to answer. They don't have access to that kind of data. When we rise above the clinical level and look down from the bird's eye perspective, let's say we make a graph and we look at how healthy people are, how healthy they've been over their lifetimes, and project on an individual basis how likely they're going to be healthy and how long they're likely to live, we start seeing big differences. You do it in every society. In some societies, though, you see huge differences. And in others, you see narrower differences. In some societies, you see differences in which people are clustered around the median, and others, which may have the same average, by the way, you see a big group up here and a big group down here. And then in other groups, in other societies, you'll see there are differences, but everyone's doing quite well. That's in Japan, for example. Whereas in another society, the gap between the people who are doing well and the people who are doing less well, let's say in terms of numbers of years they can expect to live, the gap is the same, but it's much lower. Everyone's transposed lower, so that in effect, the people who are doing better will live a much higher percentage of years, maybe not, in extreme cases, twice as many years as the people who are doing poor. So these very different patterns of health inequality are apparent when we look at this bird's eye perspective. That's, I think, an excellent example of the kind of ethical question arising, or bioethical question arising at the population level. The great thing about Brocher is that they've allowed us to take our time to draw people into this conversation, to bring here to Hermas the world's leading authorities in a number of fields, both philosophy, but also medical fields, so social sciences and more. And we have this wonderful privilege of spending 5 days and evenings together. And moreover, in these sessions, we start out with a strong contingent of the world's most eminent people, but then we open up by competition the right to join us on the part of junior people, grad students, young faculty, postdocs, and so on. Many of whom they're brilliant, and they are tomorrow's great authorities. And so here we have in the room not only generational divides, but also differences in status at the moment and so on, and in other kinds of perspectives. And the result, as we have experienced this week, is this wonderful exchange of views and deepening of our understanding of these questions that allow us to get into these very hard to understand, very hard to explain questions and really achieve some clarity and make some progress and think about where we want to go.